Hi guys and welcome to my channel. Myself Dr. Akshay, and in today's session I'm going to be discussing about the topic vascular remodeling in response to chronic changes in blood flow or blood pressure. If you guys want to learn more about the circulatory system, then click subscribe and the bell icon. So let's do this together. So coming to the topic, vascular changes in response to chronic changes in blood flow or blood pressure. So there are four different types of vascular remodeling. The first one is inward eutrophic remodeling, and the second one is hypertrophic remodeling, and the third one is outward remodeling, and the fourth one is outward hypertrophic remodeling. So coming to the first one, that is inward eutrophic remodeling. So here in this inward eutrophic remodeling, no changes occurs in the total cross-sectional area of the vessel wall. So you can see in this figure represents the inward eutrophic remodeling. Here you can see no changes has occurred before and after the increase in blood pressure. That is, the total cross-sectional area remained the same. So here in this inward eutrophic remodeling, the constriction of blood vessels occurs. That is, small blood vessels like arteries and arterioles will get constricted in response to increased blood pressure. And this constriction is just to protect capillaries and organs with that increase in blood pressure. And during this constriction process, these endothelial cells and vascular smooth muscle cells will rearrange themselves around the lumen, thereby helping in the constriction process. So coming to the second one, that is hypertrophic remodeling. So in this hypertrophic remodeling, increase in cross-sectional area of the vascular wall occurs. So you can see this figure. So this is before the increase in blood pressure. Okay. So after the increase in blood pressure, you can see this vessel wall only got thickened. Here the vessel wall thickness or vessel wall diameter has only got increased, whereas this lumen diameter remained the same before the increase in blood pressure. And this hypertrophic remodeling occurs in larger blood vessels. In inward eutrophic remodeling, I have told that these small blood vessels such as arteries and arterioles will get constricted. This constriction is in response to increased blood pressure. Whereas in case of larger blood vessels, these larger blood vessels will never get constricted in response to increased blood pressure. Instead, their vessel wall will get thickened. These larger blood vessels will respond to increased blood pressure by thickening their vascular walls. When the size of the vascular smooth muscle cells increases at the vessel wall, this increase in vascular smooth muscle cells will stimulate the extracellular proteins. These extracellular matrix proteins are fibronectin and collagen. These fibronectin and collagen will help to withstand higher blood pressures, that is, by reinforcing the vessel wall thickness. Next, coming to the third one, that is outward remodeling. So this outward remodeling occurs when this blood vessel is exposed to chronic increase in blood flow. So here, because of this chronic increase in blood flow, this lumen diameter increases. So you can see in this third figure, that is before and after. So before increase in blood flow, this vessel is looking like this. And after increase in blood flow, you can see this lumen diameter got increased. So what about the thickness of the vascular wall? The thickness of the vascular wall in outward remodeling will not change. That is, before the increase in blood flow, whatever the thickness of the vascular wall was present, the same is present after the increase in blood flow also. But little change in vascular wall thickness may occur with increase in lumen diameter. This occurs mainly in atherosclerosis patients, that too in the early stage of atherosclerosis. In the early stage of atherosclerosis, when plaque starts growing, these arteries will grow or arteries will increase its diameter outwards. This is to increase the lumen diameter so that it can protect the lumen from the plaque. And next, coming to the last one, that is outward hypertrophic remodeling. This outward hypertrophic remodeling occurs when the blood vessel is exposed to increased blood flow as well as to increased blood pressure. So before in outward remodeling, I have discussed that this outward remodeling occurs when the blood vessel is exposed to increased blood flow. Whereas in this case, that is in outward hypertrophic remodeling, this occurs when the blood vessel is exposed to increased blood flow as well as to increased blood pressure. So here we can say that in outward hypertrophic remodeling, increase in lumen diameter as well as increase in vascular wall thickness occurs. So here we can say that increase in lumen diameter plus increase in vascular wall thickness will contribute to the total increase in cross-sectional area of that vessel. An example for this occurs in pulmonary hypertension cases. In pulmonary hypertension, these pulmonary blood vessels will increase in its diameter. That is, they will increase their lumen diameter as well as their vascular wall diameter. Pulmonary arteries undergo this to withstand increased blood pressure as well as increased blood flow. So that covers the topic vascular remodeling in response to chronic increase in blood pressure or chronic increase in blood flow. I hope you guys learned about this particular topic. Thank you so much guys. See you guys in the next session.